Most people believe that if they avoid smoking and exercise regularly, their heart will be fine. That might have been true at 40. At 65, the rules change completely. I've held beating hearts in my hands more times than I can count. I've opened over 2,000 chests in my career as a cardiothoracic surgeon. And what I've seen on the operating table has taught me something most doctors don't tell you. The habits that protected your heart at 30 can silently damage it after 60. I met Gerald 3 years ago, 72 years old. Retired postal worker, never smoked, walked 4 miles every morning, did everything the brochures told him to do. He came into my office after his 3rd episode of chest tightness. When I looked at his scans, I saw a heart that had been quietly failing for years. The damage wasn't from what he was doing wrong. It was from what he thought he was doing right. When I asked about his daily routine, I found 7 habits that had been working against him. Gerald thought he was being healthy. His heart knew otherwise. Here's what nobody tells you about turning 60. Your cardiovascular system doesn't just age. It fundamentally transforms. The elasticity in your arteries decreases by nearly 40% between ages 55 and 75. Your heart muscle thickens. Your blood vessels stiffen. This isn't a gradual decline. It's a biological shift. The habits that worked when your vessels were flexible now create stress patterns your aging heart can't handle. Think of it like this. Your cardiovascular system at 30 is like a new garden hose. Flexible, responsive. That same hose after 30 years becomes brittle and rigid. The same water pressure that was fine before now creates stress points. That's your heart after 60. Same job, different tolerance. Now let me walk you through the 7 everyday habits damaging your heart right now. Habit 1, drinking water only when you're thirsty. After 60, your thirst mechanism becomes unreliable. Studies show older adults have decreased sensation of thirst even when dehydrated. This matters because when you're mildly dehydrated, your blood becomes thicker. Your heart has to work harder to pump it. Over months and years, this constant extra effort leads to left ventricular hypertrophy, an enlarged, overworked heart muscle. Here's the mechanism. Your blood volume decreases when you don't drink enough. To maintain blood pressure, your body constricts vessels and increases heart rate. For a younger heart, this is temporary. For a 65-year-old heart with stiffened vessels, it's chronic stress. The age-specific risk is this. After 60, your kidneys become less efficient at concentrating urine. You lose more water through normal function. Combined with decreased thirst, you end up chronically mildly dehydrated without feeling thirsty. Gerald drank when he felt thirsty. Maybe 3 glasses a day. His blood was running thick. No wonder his heart was struggling. The specific fix: set a timer. Drink 1 8-ounce glass every 2 hours while awake. Not coffee, not juice, water. Keep a water bottle on your counter. Fill it twice daily. If your urine is darker than pale yellow by mid-morning, you're behind. This is cardiac protection. Habit 2, taking your medications all at once in the morning. If you're on multiple heart medications, this habit is creating blood pressure swings your doctor isn't seeing. When you take 3 or 4 medications simultaneously, they all hit your system within the same 2-hour window. Your blood pressure drops. Then, 8 hours later when they wear off, everything rebounds. Your vessels experience shear stress. That's the force of blood pushing against artery walls. Older hearts can't adapt quickly to these swings. You go from medicated hypotension in the morning to rebound hypertension in the evening. The cumulative effect creates microdamage in the small vessels that feed your heart muscle. Most medication studies are done on younger patients, taking 1 drug at a time. They don't account for being 72 and taking 5 medications. The age-specific risk is accumulation. After 60, kidney clearance rate decreases by about 1% per year. Medications stay in your system longer. When you dose everything at once, the peak concentration is higher and lasts longer. The specific fix: talk to your doctor about splitting your doses. Some medications in the morning, some at night. This creates stable blood levels throughout the day. Gerald was on 4 medications. We split them. 2 in the morning, 2 at night. Within 3 weeks, his energy improved. His blood pressure became stable. Same medications, different timing. What's the single habit you think is helping your heart but might actually be hurting it? Leave a comment below. I read everyone. Habit 3, going to bed at different times every night. This disrupts something called circadian blood pressure dipping. In a healthy cardiovascular system, your blood pressure naturally drops by 10 to 20% during sleep. This gives your heart and vessels a nightly recovery period. When you go to bed at 10 p.m., one night and 1 a.m., the next, you prevent this dipping pattern from establishing. Your blood pressure stays elevated through the night. Your heart never gets the break it needs to recover. The mechanism involves your autonomic nervous system. This is the part that runs without conscious thought. It controls heart rate, blood pressure, digestion. It operates on rhythm. When you maintain a consistent sleep schedule, your system anticipates the pattern. It prepares for sleep before you even lie down. Blood pressure drops, heart rate slows. When your schedule is chaotic, this never happens. After 60, your autonomic system becomes less flexible. It can't adapt to irregular patterns like it could at 30. A single late night can throw off your blood pressure rhythm for 3 days. I've monitored patients with 24-hour blood pressure cuffs. Those with irregular sleep showed blood pressure that barely dipped at night. Their hearts were working a double shift. Gerald kept a sleep diary. Some nights he went to bed at 9 p. and, some nights midnight. His monitoring showed almost no nocturnal dipping. We set a fixed bedtime of 10 p. and, within 2 weeks, his nighttime readings dropped by 15 points. Same person, same medications, only the sleep consistency changed. The specific fix: choose a bedtime and stick to it within 30 minutes. 7 days a week, even weekends. Your cardiovascular system doesn't know it's Saturday. Set an alarm 90 minutes before bedtime. Begin winding down. Dim the lights. Lower the temperature. Your heart will thank you. Now here's where it gets interesting. Between habits 3 and 4, there's something critical I need to explain. Most of what I'm sharing today, your doctor knows, but here's what they don't have time to tell you. After 60, chronic low-grade inflammation becomes the primary driver of cardiovascular disease. Not cholesterol, not blood pressure, inflammation. And the next 3 habits all trigger inflammatory cascades in your body. That inflammation damages your blood vessels from the inside out, creates plaques, weakens artery walls, increases clotting risk. Understanding this changes everything about how you protect your heart. So stay with me through habits 4, 5, and 6. This is where the real damage happens, and where the real protection begins. Habit 4. Eating dinner after 7 p. Late eating creates something called postprandial lipemia. That's a temporary increase in blood fat levels after a meal. Normally, your body clears these fats within a few hours. But when you eat late and then go to bed, your metabolism slows before the fats clear. Those fats stay in your bloodstream longer. They oxidize. They become sticky. They adhere to your blood vessel walls. This is how plaques begin. The mechanism is tied to your circadian rhythm. Your body's ability to process fats peaks in the afternoon and declines sharply after sunset. This made perfect sense for our ancestors who ate their last meal before dark. For modern humans, eating dinner at 8 p. as it creates metabolic chaos. Your digestive system is trying to process food while your circadian system is trying to shut down. The result is inefficient fat clearance and elevated inflammatory markers. Here's what happens specifically after 60. Your metabolism slows further with age. Your body produces less bile acid. Your liver becomes less efficient at processing dietary fat. When you combine age-related metabolic decline with late-night eating, you get prolonged exposure to oxidized fats. I've measured inflammatory markers in patients before and after changing their dinner timing. The difference is dramatic. Eating at 6 p. versus 9 p. can mean the difference between normal CRP levels and elevated inflammation. Gerald ate dinner at 8:30 most nights. He worked late, came home, cooked a full meal. By the time he sat down to eat, it was almost 9 p. We moved his dinner to 6 p. He had a light breakfast, moderate lunch, and his largest meal in the early evening. His triglyceride levels dropped by 40 points. Same diet, different timing. His body could actually process what he was eating. The specific fix: eat your last meal at least 3 hours before bed. If you go to sleep at 10 p. eyes finish eating by 7 p. if you must eat later, make it light. A small portion of protein and vegetables. Nothing heavy, nothing fried. Give your metabolism time to clear the fats before you lie down. This single change can reduce your inflammatory burden more than any supplement on the market. Habit 5. Sitting immediately after meals. When you sit right after eating, you compress your digestive system. Blood flow to your intestines decreases. This slows digestion and increases the time food sits in your stomach. Slower digestion means prolonged blood sugar elevation. Prolonged blood sugar elevation triggers insulin release. Chronic insulin elevation drives inflammation. It also promotes visceral fat storage. That's the fat around your organs, the dangerous kind. The mechanism is straightforward. After eating, your body needs to direct blood flow to your digestive tract. When you sit, especially in a slouch position, you reduce the efficiency of this process. Your stomach struggles to empty. Your blood sugar stays elevated longer than it should. Your pancreas keeps pumping out insulin. Over months and years, this pattern leads to insulin resistance. And insulin resistance is a direct pathway to heart disease. After 60, this matters more because your digestive motility naturally decreases. Your stomach empties more slowly than it did at 30. Your intestines move food through at a reduced pace. When you add sitting to already slow digestion, you create a backup. Food ferments, gas builds, bloating occurs, but the real damage is the prolonged metabolic stress. Your body is working harder and longer to process the same meal. I had a patient, Sarah, 68 years old, who came to me with persistent high blood sugar after meals. She wasn't diabetic. Her fasting glucose was normal, but post-meal readings were spiking to 180. When I asked about her routine, she ate lunch at her desk every day, sat for 3 hours afterward. We changed one thing. After lunch, she took a 10-minute walk around the parking lot. Gentle, not strenuous, just moving. Her post-meal blood sugar dropped by 30 points. Same food. She just moved instead of sitting. The specific fix. Walk for 10 to 15 minutes after every meal. Not a workout, just gentle movement. This helps gravity move food through your system. It increases blood flow to your digestive tract. It signals your muscles to take up glucose from your bloodstream. Your blood sugar stabilizes. Your insulin response moderates. Your inflammation decreases. Starting tonight. After dinner, walk around your house, around your block. Just move. Habit 6. Brushing your teeth only once a day. Poor oral hygiene is one of the most underestimated cardiovascular risk factors after 60. Here's why. Your gums harbor bacteria. When you don't brush regularly, those bacteria multiply. They cause gum inflammation. That inflammation creates an entry point for bacteria to enter your bloodstream. Once in your blood, these oral bacteria travel to your heart. They contribute to arterial plaque formation. They've been found in the plaque removed from coronary arteries during surgery. The mechanism is called bacteremia. Every time your gums bleed, bacteria enter your bloodstream. If this happens occasionally, your immune system handles it. If it happens daily because your gums are chronically inflamed, your immune system is constantly fighting a low-grade infection. This triggers inflammatory cytokines. These cytokines damage your blood vessel lining. They promote clot formation. They accelerate atherosclerosis. After 60, your gum tissue becomes thinner and more vulnerable. Your immune system becomes less efficient at clearing bacteria. You produce less saliva, which normally helps wash away bacteria. This combination creates a perfect environment for chronic oral inflammation. Studies show that people with periodontal disease have 2 to 3 times the risk of heart attack compared to those with healthy gums. That's a bigger risk factor than many things your doctor regularly monitors. Gerald had bleeding gums when he brushed. He thought it was normal for his age. It wasn't. We referred him to a periodontist. He got a deep cleaning, started brushing twice a day and flossing every night. Within 6 months, his gum inflammation resolved. His CRP level, a marker of systemic inflammation, dropped from 3.2 to 1.1. His cardiologist was shocked. Same medications, same diet. The only change was oral hygiene. The specific fix: brush your teeth twice a day, morning and night. Floss every single night before bed. Use an electric toothbrush if possible. It removes more plaque than manual brushing. See a dentist every 6 months for cleaning. If your gums bleed when you brush, that's not normal. That's a sign of inflammation that needs treatment. Your mouth is connected to your heart. Treat it that way. Habit 7. Sleeping on your right side. This one surprises people, but the position you sleep in affects how your heart functions through the night. When you sleep on your right side, gravity pulls your heart toward the right side of your chest cavity. This changes the angle of blood return to your heart. It can compress the vena cava, the large vein that returns blood from your lower body. This creates subtle changes in cardiac output through the night. The mechanism involves something called venous return. Your heart depends on steady blood flow coming back from your body. When you compress the vena cava by lying on your right side, you reduce this return flow. Your heart has to work slightly harder to maintain the same output. For a young, healthy heart, this is negligible. For a 65-year-old heart that's already working at capacity, this subtle extra work adds up over 8 hours of sleep. Here's the research. Studies using overnight cardiac monitoring show that right-side sleeping increases episodes of atrial arrhythmia in older adults. These are irregular heartbeats that can increase stroke risk. Left-side sleeping, by contrast, actually improves cardiac efficiency. The heart is already positioned on the left side of your chest. When you sleep on your left, you're working with gravity instead of against it. Blood return is optimized. Your heart works less. I sleep on my left side. So does my wife, also a physician. When Gerald came in with complaints of waking up with his heart racing several times a week, I asked about his sleep position. He slept exclusively on his right side, had done so for 40 years. We asked him to try left side sleeping for 2 weeks. The nighttime palpitations stopped. He couldn't believe something so simple made such a difference. The specific fix: train yourself to sleep on your left side. If you're a habitual right side sleeper, this takes adjustment. Put a pillow behind your back to prevent rolling over. Some patients use a tennis ball sewn into the right side of their pajama top. It makes right side sleeping uncomfortable enough that they naturally shift left. Give it 2 weeks. Your heart will adjust to the new position. The improvement in overnight cardiac efficiency is measurable. I need to tell you something about Gerald that still amazes me. 6 months after we made these changes, he came back for a follow-up stress test. His ejection fraction, the measure of how well his heart pumps, had improved from 42% to 51%, normal range. His cardiologist called me personally. He wanted to know what medications I'd changed, what new drug protocol we'd started. I told him we hadn't changed any medications. We changed 7 habits. We adjusted his water intake to scheduled glasses every 2 hours. We split his medication dosing between morning and evening. We fixed his sleep schedule and moved his bedtime earlier to 10 p. Every night. We moved his dinner from 8:30 to 6 p. We had him walk for 15 minutes after every meal instead of sitting. We addressed his oral hygiene with twice daily brushing and nightly flossing. We changed his sleep position from right side to left side. 7 habits. All things he could control. Measurable cardiac improvement in 6 months. Gerald said something to me at that visit that has stayed with me for 3 years now. He said, "Doctor, I did everything the pamphlets told me to do for 20 years. I exercised. I ate healthy foods. I took my medications exactly as prescribed. But nobody ever told me about the timing of when I ate, the position I slept in, the schedule I kept, all these little details that actually mattered to my heart. That's the gap I see every single day. Doctors mean well. The system doesn't give them time to explain the details that make the difference. So patients like Gerald do everything right according to the guidelines and still get worse. It is never too late. It doesn't have to be this way. Let me give you the 7 habits one more time so you can write them down. Number 1, drink water on a schedule, not just when you're thirsty. 1 glass every 2 hours while you're awake. Number 2, split your medications between morning and evening doses. Talk to your doctor about the timing that works for your specific situation. Number 3, go to bed at the same time every single night within 30 minutes. Your heart needs consistent rhythm to maintain proper blood pressure dipping. Number 4, eat your dinner before 7 p. Give your metabolism at least 3 hours to clear fats before sleep. Number 5, walk for 10 to 15 minutes after every meal. Don't sit immediately. Movement helps your body process food efficiently. Number 6, brush your teeth twice a day and floss every night before bed. Your mouth affects your heart more than most people realize. Number 7, sleep on your left side instead of your right. It improves cardiac efficiency throughout the night. These 7 changes cost nothing. They require no prescription. They work. Here's what I want you to do right now. Pick one habit from this list, just one. The one that surprised you most, or the one you know you're currently doing wrong. Write it in the comments below. Tell me which specific habit you're changing starting tonight. I read every comment. I respond when I can. Seeing your commitment helps other viewers make changes too. We're building a community of people who refuse to accept that heart disease after 60 is inevitable. It's not. You have more control than you think. If this video helped you understand something your doctor didn't have time to explain, share it with someone who needs to hear it. Someone in your family who's over 60. A friend who's struggling with heart issues. This information works when it's applied. It only gets applied when it's shared. Hit that share button. And if you want more videos like this, where I break down the medical details your doctor doesn't have time to explain, subscribe to this channel. Click the bell so you don't miss the next one. Next week, I'm talking about the 5 blood tests everyone over 60 should demand that most doctors never order. These tests catch problems years before symptoms appear. You don't want to miss that. Your heart has been working for you every single minute of every day since before you were born. It's never stopped, not for a second. After 60, it deserves your attention to the details that matter. Not just the big changes, the small ones, the timing, the position, the habits nobody mentions. That's where the real protection lives. I'm not your doctor. This video is for educational purposes only. Always consult with your personal physician before making changes to your medication schedule or treatment plan. But I am a surgeon who has seen what works and what doesn't. And what I've shared with you today works. The research supports it. The patient outcomes prove it. Now it's up to you to apply it, starting tonight.